Lascan Corla, first of all, I want to particularly acknowledge the support of my colleagues in the regional group, because the reality is that many patients with long COVID are not being believed. And this Dáil motion provides at least some official acknowledgement that they are being listened to. And in fairness to most TDs in this House, they have not recognised this issue to date because patients haven't been coming directly to them. And I want to thank Coach Gowlev and in particular the Library and Research Service for their support and for performing a significant amount of the background research over the last year, which has assisted me in helping to highlight the need to support long COVID patients across this country. Ministers, I want to thank you and to thank colleagues right across the House for the support in allowing this important motion on long COVID to be adopted unopposed. Now, Ministers, I want you to keep two things in mind when this debate is over today. One is 6 months and the other is €500 million. Ministers, presently long COVID patients have to suffer for an average of 6 months before they get their first appointment in the specialist clinics that are being established by the HSE across the country, because these clinics are not being staffed. Now, both of you ministers have made reference to the long COVID clinics and referenced specifically St Vincent's Hospital, Beaumont Hospital and Galway University Hospital. There are just 2 staff appointed to St Vincent's University Hospital long COVID clinic. There is no staff appointed to the Beaumont Clinic and none appointed to the Galway University Hospital Clinic. That's why people are waiting. And yet the Mater Hospital Clinic is set to close at the end of this year. Long COVID patients with serious and debilitating medical conditions, from brain fog to chronic fatigue, are waiting an average of 10 weeks from the referral to these specialist clinics, with the longest waiting for 42 weeks for patients trying to access the clinic at St Vincent's Hospital in Dublin. And we mustn't forget that in order to meet the criteria for long COVID, a patient must be experiencing their symptoms for at least 12 weeks, and if they are lucky, they will get to see a GP and be referred on to the clinic in a further 4 weeks. This results in people suffering with long COVID-related symptoms having to struggle with their illness for at least 6 months on average, or for well over a year if they're waiting to access the support at St Vincent's Hospital in Dublin, like Deputy Johnny Brady that spoke earlier. While the longest waiters after the referral to St Vincent's Hospital are the ones in Tallaght, waiting for 26 weeks after referral, in Galway or Cork University Hospital 20 weeks, and Galway University Hospital 16 weeks after referral. And Minister, long COVID is costing at least €500 million in lost work and welfare alone. Data from the Department of Social Protection shows that 0.81% of those who contracted COVID-19 and claimed the enhanced illness benefit payment were medically certified as being unfit to work 12 weeks later. Extrapolating this across the total number of people infected with COVID-19 in the adult population equates to 21,459 adults who are unfit to work or to hold down a job. Now, Ministers, if we use this arbitrary 6-month waiting time for care, this equates to €586 million in lost wages and welfare payments alone, never mind the impact that long COVID is having on our already overburdened health service. Now, we've heard earlier on personal stories from colleagues here in the House, and we have long COVID patients here in the gallery, each and every one of them representing thousands of patients across the country, many of whom are watching this particular debate on our Oireachtas TV today. And Minister in Taoiseach, I finally want to leave with you 2 stories from a 10-year-old boy, Oisín, and an 11-year-old girl, Orla. The 10-year-old boy, Oisín, performed when the Taoiseach went and visited his school recently and opened the school Taoiseach. And this was a very proud day for him to have the Taoiseach there, and a proud day for his family. But sadly, his mum, who's housebound, wasn't physically able to witness that performance because she has long COVID. 11-year-old Orla is attending a school just 3 days a week because of the symptoms of long COVID. But as she says herself, I'm still struggling, and some days I even have to go home earlier. Taoiseach, ministers, COVID is having a big impact has had a big impact on all of us. But please ensure that our children like Oisín and Orla, don't continue to suffer because long COVID patients cannot get access to the medical care that will make a real difference on their road to recovery.